Hi everyone, I am Beatrice. In today's video, we'll look at levels of prevention. So this is a topic that can be confusing in exam. Now, at the end of this lecture, this topic should be very easy for you. If I want to see it in exam, it will be like a takeaway for you. Also, at the end of this lecture, there will be a free quiz that will test you on this topic. I will leave the link in the description. So stick around, let's dive in. In public health and in nursing, when we talk about levels of prevention, it simply means activities that are done to either prevent the development of disease or to detect disease at an early stage, treat that disease, and prevent development of disabilities. So we have different levels of prevention, but for the sake of your exams, they basically ask questions on primary level of prevention, secondary level of prevention, and tertiary level of prevention. So that will be our focus. However, I will just throw a little light on other levels of prevention. There's what we call primordial prevention and quaternary prevention. So for primordial, it has to do with those activities that are done to prevent the development of risk factors. So it's just like the government today just decided, okay, instead of telling people to stop smoking so that they don't develop cancer and any other problem that comes with smoking, why don't we just ban the use of tobacco, the use of any of those products that can even put them at risk in the first place? So such activities are primordial prevention, just to activities that are carried out or that are done to prevent exposing people to risk factors. So that means primordial will come before primary level of prevention. Now for quaternary, that will be after tertiary level of prevention. So for this one, we're looking at activities that you want to take to prevent unnecessary diagnosis or unnecessary exposing patients to unnecessary procedures. For example, reducing the use of polypharmacy where a patient uses so many medications. So if you evaluate it and you see that the patient may not need some of this medication and you decide to, cut down some of those medications, you are looking at quaternary prevention. Another example of quaternary prevention can be cutting down some diagnostic procedures that may be of little or no use to the patient, and also putting into consideration ethical principles before taking any decision on the patient. Now, for primary level of prevention, the goal is to prevent the onset of disease or injury before it occurs. Examples include things like immunization, regular exercise, healthy eating, health education, any activities that stop development of disease condition, like smoking cessation programs, use of seat belts, use of helmets to prevent injuries. Now, how we apply this kind of prevention in question. Example, a nurse teaching about importance of regular exercise and healthy eating to prevent heart disease. So it's not just that the nurse is teaching, it's not just about health education, because when we look at tertiary level, we also see that the nurse will also teach about how to prevent disability. So it's not about the teaching aspect, but it's about what the nurse is teaching. So for this one, a nurse teaching about importance of regular exercise and healthy eating to prevent heart disease. So this one in red here is the emphasis. Other examples include things like wearing sunscreen. Another one, administering vaccine, so vaccination. So when you see terms like that, it's talking about primary prevention. So the next level is secondary level of prevention. The goal of this one is early detection of disease so that prompt treatment can be taken. In other words, any activities that have to do with early detection of diseases. So let's look at example, screening test. When you go for screening, you are not preventing disease, we are going for that test to see if there's any disease developing already. So screening tests like mammograms, breast self-examination, testicular self-examination, pap smears, even when you do some procedures or you do some tests like blood pressure check, when you do blood glucose test, these are tests that is just, you are doing it just to detect a disease condition. So when you do it, it's either the disease is there or it's not there. Also, in this secondary level, in the case of acute disease, if it is diagnosed, for example, somebody just develops strep throat, at that point, it's an acute infection that needs to be handled. So that treatment that will be given at that time will still fall under secondary level of prevention. So it's not just only detecting disease, but that prompt action also taken at that point, especially when it's at the acute stage. Application. Example, a patient undergoing a routine colonoscopy to screen for cancer of the colon. So that kind of this, the one I've highlighted there, a routine colonoscopy to screen for. So we are screening to detect something. So that would be under secondary level of prevention. Now, the last one is tertiary level of prevention. So this one has to do with reduction of complication, helping patients to cope with diseases. Any of those activities that fall under physical therapy, any of those support programs, helping with self-esteem, they all fall under tertiary level of prevention. Is to reduce the gravity, to reduce the extent of problem that will come from that diagnosis. So when we look at tertiary level of prevention, most time it relates to chronic diseases. This patient is going to live with this disease for the rest of their life. But what are those activities that can be done to limit or reduce complication or disability from that disease? That will fall under tertiary level of prevention. For example, any rehabilitation program like cardiac rehabilitation, it will fall under tertiary level of prevention. Support groups for patients that have, maybe they have cancer and you refer them to a support group, or any other of those problems, coping with any of those chronic conditions, to any of those programs to reduce disability, to reduce contractures, any of those physical therapy where you do exercise for the patient, those OTPT. Imagine a patient that have just recovered from stroke. We don't want them to remain incapacitated. We don't want this patient not being able to recover or being able to take care of themselves. So they begin to, rehabilitate them, begin to do some physical activities for them, physical therapy, exercise. The OTPT will be there to help them to see how they can cope and reduce disability. For example, a nurse teaching a type 2 diabetes patient how to care for their feet to prevent the development of foot ulcer. Now, don't confuse this with primary level of prevention because you are seeing the word teaching. No, the purpose of this patient being taught, or the purpose of the nurse educating this patient, is not to prevent them from having diabetes. They already have it, but you are teaching them what to do to prevent complication, because if they develop foot ulcer, it can lead to amputation. So that kind of teaching will fall under tertiary level of prevention. Another one is like cardiac rehabilitation. Other one is physical therapy to improve mobility. So that wraps up today's topic on levels of prevention. If you find this video helpful, please like, share, and subscribe for more educational videos. Thanks for watching.